Hello, my fellow broke aristocrats. Hello, hello. I have been off for a couple of days, and it is the middle of summer here in West Hollywood, and it has been hot, and be quite honest with you, I'm just not motivated. But I missed you all, and so today I decided to cover a topic that I think is really important, and I've dedicated this month to heart health, to really doing what I can to help my fellow broke aristocrats check in on themselves, check in on their loved ones, and make sure that we are empowered to know what we need to know in order to make sure everyone is healthy and everyone is experiencing good heart health. Excuse me. Our hearts are important, and we fellow broke aristocrats have big hearts, and so we want to keep those hearts healthy and happy. So today we're talking about how to prevent a heart attack, and as many of you know, this channel is dedicated to healthy living on a budget. And the reason I chose this topic is because heart disease is a leading killer in the United States. It's unfortunately right up there as one of the top causes of death in the United States. But the good news is that there is a lot we can do to prevent heart disease, and we can prevent a heart attack. So the first thing I want to do is talk about risk factors. What are the risk factors for having a heart attack? Well, the first thing we can't really do much about, and that is age. As we get older, unfortunately, we are at greater risk of a heart attack. This is why it's so important as you get older to make sure you're getting those annual checkups, seeing your doctor, having a full workup done. We want to be looking at those cardiac markers, particularly if you're over the age of 50. We're going to be doing everything that we would normally do, looking at your blood, but we also want to be looking at things like C-reactive protein. Your doctor may also want to do a calcium score if he or she thinks that you are at risk for coronary artery disease. Sometimes doctors will order something called homocysteine along with a C-reactive protein to find out if there is inflammation. We also look at particle sizes, the particles, the size of LDL and the size of HDL, VLDL. These are basically indicators that let us know how well your body is processing and eliminating cholesterol. So those are some of the tests your doctor may run. So again, age is one of the major risk factors, and this is one of the reasons why as we get older we really want to work closely with our doctors to make sure all those tests are run, and that if there is a medication we need to be on, in addition to diet and exercise, we really want to be consistent with taking those medications. So age number one, family history, believe it or not. If you have had people in your family, a mother, a father, a brother, with a history of coronary artery disease, what we call familial hyperlipidemia, a family history of heart attack or heart disease, that is certainly going to be a risk factor. Weight, if you are overweight, if you are deconditioned, if you're not exercising, and if you are carrying around an extra 20, 40 pounds, this might be a motivator to get out that exercise bike and start exercising. What is the Stairmasters that people get? But whatever choice of exercise you decide to do, it's important that you get up and move and get the weight down. Diabetes, a previous history of diabetes, type 2 diabetes, definitely. And the reason why diabetics, that's a population that we're concerned about, is because a lot of the times with diabetes, particularly in advanced cases of diabetes, we see patients that don't necessarily know when they're in pain, and that is because we see neuropathy and a loss of some nerve sensitivity in people who have a history of diabetes, and so they may not be as aware when they are showing early signs of heart disease. And that is also true with older individuals who have heart disease, where they may be losing sensation or difficulty sensing that something is wrong. So those are all some of the risk factors. Women often will get misdiagnosed. When we think about heart attacks, we often think about older male overweight. But women, we also have to understand that women are also at risk for heart disease, and that heart disease is a leading cause of death in women as well. So what are the signs and symptoms that you may be experiencing days before a heart attack, or even months before a heart attack? Well, if you're having difficulty exercising, if you're having trouble climbing up those stairs, if you're having trouble getting your breath up, wheezing, panting with just the smallest amount of exercise, that could be an early sign that something is wrong. I want to be clear when we talk about coronary artery disease also, because a lot of people don't actually know what coronary artery disease is. Coronary artery disease, those are the arteries. I'll show you a picture. Those are the arteries that are actually bringing oxygen and nutrition to the heart wall, to the heart muscle. And so the one specific artery where we see the biggest problem is the left anterior descending. I'll show you a picture of that as well. So these are the arteries that can become blocked or occluded, and they're blocked with something we call plaques. Now, we're pretty sure we know how a heart attack happens, and that is that these plaques, which are kind of like scar tissues, can break off. And when they break off, it can cause a bleeding of the side of the wall of the artery, and that can result in a clot. And the reason why the left anterior descending is so vulnerable to this is because there aren't a lot of other oxygen sources for that part of the heart. In plainer words, if you lose that oxygen supply that's coming from that artery, that whole section of the heart, that left ventricular area, is going to be vulnerable to a loss of oxygen, or what we call ischemia, a loss of oxygen to that portion of the heart. And if other arteries in the heart become occluded or partially occluded, often another artery can come in and do the job, and it can bring oxygen to that area. But unfortunately, with the left anterior descending, there are no other arteries around that can step up and replace the loss of a left anterior descending artery. I hope I'm explaining this in a way that people understand. In plainer words, there's no other oxygen source. So when we lose that, that is when we are at risk of a lack of oxygen to the heart and a heart attack. Now, this is different than angina. Angina is also ischemia, lack of oxygen to the heart, but it doesn't necessarily mean lack of oxygen to the heart via the coronary arteries. It can be due to a spasm in the ventricles, spasm in the aorta. It can be, in that sense, we call it stable angina, and it's improved with nitroglycerin. People will take medicine, they'll feel better. When you're having pains that indicate you're at risk of a heart attack, we'll get what's called a Levine's sign. People who, before they even will have a heart attack, they will begin doing this. You know, they say that they feel a pressure in their chest, and they will often make this sign over their chest. And that sign, doctors call that the Levine's sign. So if you're concerned about a loved one, that is what you're going to be looking for. So a person who also, before a heart attack, they may talk about feeling a pressure in their chest, a pressure in their neck area, numbness in the jaw. They may even complain about a toothache and make an appointment to see the dentist because the pain can radiate. Those are all signs of ischemia, or what we would call, in this case, possibly an unstable angina. And in a case of an unstable angina, that's ischemia or lack of oxygen to the heart, possibly due to unstable plaques or a blockage in that left anterior descending artery. A person may also complain that they feel dizzy. When they are active, they may feel a sense of doom prior to having a heart attack, trouble breathing while lying down. If you have a loved one who lies down and then has trouble breathing, this could be also an indication of advanced coronary artery disease. We talked a little bit about pain, but I want to emphasize that in women it may be a little bit different. In a woman, it may be a feeling like the bra is getting tighter, like, why are my bras always uncomfortable? I used to not have this problem, but now I'm really noticing it more than ever. The other thing about coronary artery disease is that it's a pain that is not better necessarily by being inactive. For example, you may feel dizzy or weak or sweating or trouble breathing even with mild exertion, but if you're having pain in your chest and you sit down and you rest and you don't see that it's alleviated after about 20-30 minutes, that can also be an early indication of a heart attack or being really at risk for heart disease. So what do? Well, as I said before, it's really important to be proactive and see your doctor on a regular basis, particularly as we get older. If it's an acute MI, common knowledge is to dial 911 and to chew on a baby aspirin. I think that's a great idea. So those are all things that have to happen if you're in an emergency situation. Now, if you're a broke aristocrat, you like preventative medicine. And so what can you do in addition to seeing your doctor, being proactive, staying on your medication, checking your cardiac markers, working with a good internist and cardiologist? All of that is important. Well, what else can you do to help your doctor help you? Well, one of the things we talk about, if you get the okay from your doctor, because we always want to make sure you've gotten the okay from your doctor, is to begin slowly introducing cardio exercise. We don't want to go from 0 to 100, but to the best of your ability, we want you to begin to get up and begin moving. And that may mean only taking a walk around the block one time, getting into the water, getting into the jacuzzi and kicking around. Jacuzzis are hot water. I'm not a fan of that, but mild swimming and playing in the water is one of my favorite forms of exercise because it's easy on the joints. In terms of dietary changes that a person can make who's really trying to move in the right direction and begin to eat better, I really like Dean Ornish. He wrote the book Spectrum, and what I like about Dean Ornish is because he's the individual who has compiled probably the most research on the relationship between reversing coronary artery disease and diet. And the diet he promotes is predominantly vegan. However, he allows for fish, particularly those cold water fish, salmon, anchovies, sardines, cod. Those are all good fish. Even people who can only have one fish meal a week, we see a reduced risk of coronary artery disease. The other thing about Dean Ornish is he allows for egg whites and non-fat dairy. So he's a little bit more liberal in his dietary recommendations than Caldwell Esselstyn, who promotes the low-fat vegan diet. But whatever diet you choose, we definitely want to see about 80% of your calories coming from the plant kingdom, fruits, vegetables, nuts, seeds, or what we call the GABAMs. Those are the greens, the beans, the onions. Let me see if I can remember it. I'll list it below. And seeds, nuts and seeds. So those are the GABAMs. Greens, beans, onions, mushrooms, nuts and seeds. Okay. So that is where the majority of your caloric intake would be coming from, and then approximately, I would say, 10 to 15% of the calories can be coming from poached salmon, egg whites. We don't want to see a lot of oil. If you are going to be eating oil, it's usually recommended as a handful of nuts a day. The best nut is the walnut because it's rich in omega-3s. That is really what the research shows is the ideal diet for the human body, certainly in terms of preventing coronary artery disease. All right, that's everything I have for you, my fellow broke aristocrats. If any of those signs and symptoms spoke to you, please don't wait. Please see your doctor. And I want to end by saying that denial, not wanting to believe that something is wrong, is also a risk factor that we see in people with advanced coronary artery disease. Please, please, please do not ignore these signs and symptoms if you see them in yourself or your loved one. And please reach out to me if you have any more questions. I want to thank you for watching this video of Broke Aristocrats. Please take care of yourself and reach out to me, and we'll see you next time. Take care. Bye-bye.